Hello. Hello again. Hello. Hello again.
Hello everyone, and welcome to another Top 5 Stay Alive for August 2017. Shall we begin? Alright. If you still have any doubts that the FDA approval of a drug is basically meaningless, the rheumatoid arthritis med Tamra should be enough to convince you. Despite numerous red flags before it was first okayed 7 years ago, and despite hundreds of deaths and injuries that have since resulted, not only in Tamra still selling like hotcakes, but the feds are still telling doctors it's safer than other rheumatoid arthritis drugs. Now, a new investigation into this med has revealed some of the deadly secrets about how the FDA actually operates. It's obvious that once a drug maker gets its med in the door, only under extremely rare circumstances will the FDA ever look back and see if that drug is harming more than it is helping. And that will make you think a lot more than twice before you believe FDA approved has meaning to it at all. Case in point, Alicia Ayers was sold on taking an infusion of Tamra for rheumatoid arthritis when a rheumatologist assured her the med had very few side effects. But right away, the 40-year-old Ohio woman started having heart palpitations that were so worrisome she went back to the doctor for help. He said he never heard about such a reaction to the drug, and neither had her general practitioner, who suggested she take an antidepressant since she was so anxious. And there's a very good reason her doctors didn't know about these heart reactions, and why numerous other patients who have suffered from memory lapses, brain fog, hair loss, pancreatitis, and a long list of other side effects have gotten similar responses. It seems that even though thousands of adverse event reports have been flooding into the FDA over this drug, the agency is still sitting on its hands when it comes to issuing any new warnings, or even requiring the drug maker Genentech, part of Big Pharma giant Roche, to add any of these dangers to Tamra's label. A just-out investigation by Stat News uncovered that as 2012, only 2 years after the drug hit the market, over 3,500 of these reports had been sent into the FDA adverse event reporting system, including 118 deaths, with over 40 of those due to cardiac problems. But because only drug makers are actually required to report these event reports, which for doctors and patients is entirely voluntary, the real number of actual adverse events are much higher. The bad news about Tamra, however, doesn't stop there. An FDA review that used the adverse event reporting system as well as original trial data also found over 250 cases of pancreatitis, which proves deadly for about half of those who come down with it, and 185 instances of progressive lung disease that scars the lungs and can eventually require a lung transplant linked to the drug. Stat took the data it uncovered to several experts who all agreed the agency should immediately issue warnings for heart failure and pancreatitis. And since both competing prescription meds for rheumatoid arthritis, Humira and Remicade, carry warnings about heart attacks and heart failure, you can imagine how many extra millions Tamra brings in by being sold as a safer drug. But isn't there any FDA oversight after the agency signs off on a med? As Dr. Caleb Alexander from Johns Hopkins explains, once a drug has been approved, the FDA's clout over the medication is infinitely smaller, and there's no other watchdog agency looking out for us either. While the FDA hasn't lifted a finger to tell patients about these potential dangers of Tamra, you can't say it hasn't done anything where the drug is concerned. At the end of last month, it gifted Genentech with another FDA-approved use for the med, a fast-track okay for patients who suffer from autoimmune disease called vasculitis, an inflammation of blood vessels. And that's apparently how our drug approval system was designed to work, with financial interests of Big Pharma as its #1 priority. But for the untold number of patients who've been lured into taking Tamra, thinking it was somehow safer, only time will tell if they'll become simply more adverse event reports for the FDA to ignore. So if you're one of them, it's important that you talk with your doctor right away about getting off this drug and not starting up on an equally risky one. While rheumatoid arthritis is a painful nut to crack, there are some drug-free approaches that may be able to keep you functioning and off the risky meds entirely. For example, number one, try cutting down on your red meat and adding more fish, nuts, fruits, and veggies to your diet, along with lots of extra virgin olive oil, what's known as a Mediterranean-style diet. Number two, give acupuncture a try for relief from pain and inflammation. And number three, while it may be the last thing you feel like doing, exercising, especially swimming, has been found to significantly improve rheumatoid arthritis symptoms. And of course, Health Guardian Flex is specifically formulated for rheumatoid arthritis as well as osteoarthritis. So there you go. Topic number two. When the American Heart Association issues a warning about statins, you know it's serious, because these cholesterol-lowering meds like Lipitor, Zocor, and Crestor are the mainstream's most cherished sacred cows, admitting that any problem that might be associated with them is practically treason. But these findings are so important, even the American Heart Association couldn't keep this news under wraps any longer. Statin drugs can have serious interactions with numerous other heart medications, and that can induce the risk of life-threatening bleeding for patients taking certain blood thinners. For years, statin drugs have been practically shoved down our throats, and when the old cholesterol mantra started getting stale, they turned statins into miracle meds that could stop everything from eye disease to sleep apnea. But now that 25% of all Americans age 40 and up are taking them, nobody on this, hopefully, it sounds like the American Heart Association is finally saying, Houston, we have a problem. Just last week, it released a statement telling how statin side effects such as muscle tissue damage can be intensified if you're also taking other frequently prescribed drugs for heart disease. These include a class of blood pressure meds called calcium channel blockers, such as Norvasc, blood thinning meds such as Coumadin or warfarin, and Brilinta, heart rhythm drugs such as digoxin, and even the brand new one for the heart failure called Entresto. While the mainstream media has tried to downplay reports of statin-induced muscle damage for as long as I can remember, even telling patients it was all in their heads, it's very real. Just ask anyone who has suffered through the unbearable and deliberating pain and weakness these drugs can cause. And as many have learned firsthand, the agony can continue long after they stop taking a statin. It can also result in one of the most serious muscle damaging effects of all, rhabdomyolysis. That's when muscle fibers actually die, and it can lead straight to kidney failure. The Heart Group has also warned that statins and certain blood thinning meds such as Coumadin and Brilinta can increase your odds of deadly bleed. But here's the thing. This is hardly brand new information. Researchers have been following the statin drug interaction trial for some time now. One report dated 9 years ago details how an 82-year-old woman died of brain hemorrhage while taking Zocor and warfarin. And 6 years ago, the consumer advocacy group Public Citizen warned about other fatal drug interactions with statins, telling about 2 patients who went into kidney failure while taking the drugs along with a steroid. One of them died. So you can't tell me this is a big surprise to the American Heart Association. The group tried to soft pedal its bombshell by adding that every patient is different and you should keep your doctor informed of any unusual side effects or concerns. Look, for years now I've been warning you about the real and present danger that comes along with taking statins. They're risky enough even if they are the only med you're taking. But here's what should be the biggest news of all, and you won't be hearing it from the American Heart Association. Last year, a group of Danish researchers found that even if you dutifully take a statin every single day, the time it will actually add to your life averages out to be, drum roll please, 3 to 4 days. So the reality of the statin story is these drugs can take away many more days of your life than they will ever add. Stop taking them statins. Get on cardio for life. You don't need them. Topic number 3. Researchers at Boston University Medical Center are sounding alarm over serious adverse side effects that has come to light about the prostate drug Avodart, ones that they hope doctors tell their patients about immediately. But this bad news drug has been risky from the get-go, putting untold number of men, and believe it or not, unborn babies in harm's way for a long time now. And that means for the millions of men prescribed Avodart, this warning may be coming a tad too late, like 16 years, which is how long ago it was first approved by the FDA. For any man taking Avodart to treat an enlarged prostate, Boston University researchers have some news you need to hear right away. This drug can put you at big risk for diabetes, send your cholesterol number soaring, and up your chances of developing non-alcoholic fatty liver, or NAFLD, a condition that can progress into, guess what, liver failure. And as if there weren't enough, they're also saying the Avodart can put your sex life in the rearview mirror. I know, you can't turn on the television without hearing lots of scary warnings about drugs and how they harm you all the time. But this is different. These researchers are actually warning guys that Avodart will have a negative impact on their overall health, that it reduces quality of life, and that doctors need to fully be aware of these findings. I hope they brace themselves for the wrath of Big Pharma, which has much tried to defame researchers for saying much less than that. To arrive at these conclusions, they followed 460 men between the ages of 47 and 68 for nearly 4 years. They gave Avodart to half the group and gave a similar drug called Flomax to the others. Now, Flomax is no walk in the park when it comes to having a long list of side effects that include back pain, difficulty urinating. Isn't that what the drug is supposed to treat? And also fainting. But Avodart group was plagued with high blood pressure, high blood sugar, including elevated hemoglobin A1C numbers, high lipid level, which can up your risk of heart disease, and plummeting testosterone. It's enough to make your worries over that enlarged prostate shrink before your very eyes. But the guys who took this drug, it seems, aren't the only ones that can be harmed. If a woman is exposed to the med during pregnancy, which can happen in any number of ways, there's a very real chance that if she's carrying a boy, his genitals will develop abnormally. And since the drug can be absorbed through the skin, any woman of childbearing potential is warned by the drug maker not to even touch an Avodart capsule. But seriously, how many women are reading the label for this med? And it doesn't end there. The risk is so great that men who take Avodart are told not to donate blood for 6 months after stopping the med to prevent any possibility that a pregnant woman could be exposed. Wow, hopefully doctors got that memo from Glaxo. Yeah, right. Yes, this old standby saw palmetto is on my list along with zinc, omega-3, as well as cutting down on sugar and refined flour. However, the saw palmetto absolutely must be standardized berry extract or it's not worth buying. The minimum effective dose is 320 milligrams a day, and it won't kick in for about 2 to 3 months, so be patient. Also talk with your doctor about an enlarged prostate before starting on saw palmetto. But whatever you do, don't let your doctor talk you into a prescription of Avodart. Topic number 4. Well, we all know that mistakes happen. After all, we're all human. But where biopsies are concerned, mistakes look like they're becoming an epidemic. Your biopsy can easily be confused with someone else's, or it can be misread entirely, giving you a dreaded diagnosis of cancer when you don't have it. And experts have become so blasé over these kinds of mistakes that you would think we're talking about getting served the wrong dish in a restaurant instead of losing a body part. Which is why you need to take some simple precautions before you're wheeled into the operating room or radiation facility for cancer you may not actually have. Evelyn Rodriguez said she didn't know if she should be thanking God or breaking down in tears. You see, Rodriguez had gotten the terrible news that she had invasive breast cancer and was rushed into surgery that removed her left breast. And when the 51-year-old New Yorker found out she didn't have cancer, after all, not a trace of it, she probably did both. That unnecessary mastectomy happened despite the hospital where the procedure took place having safeguards to prevent that kind of error. But there was even a slip-up with those safeguards. Frank Barrera was luckier, as he was being prepped for surgery to have his prostate removed, literally with an IV in his arm. A last-minute double check on his biopsy revealed he was perfectly healthy. Barrera said it was like waking up from a bad dream. But those bad dreams are more like a living nightmare. Former president of the American College of Radiology, Dr. Art Van Moore, said that more patients who get a cancer diagnosis are rarely sent anywhere for a second opinion. You wouldn't question your medical team, he said. Well, I don't know what era Dr. Van Moore is living in, but yes, you can and should question your care when risky, life-altering treatments are being proposed. Past studies on lab work mix-ups found cases of biopsies being mislabeled, totally switched, and even partially switched, meaning cells from one patient got mixed in with someone else's sample. And how many mistakes a lab makes has a lot to do with the number of specimens that it handles. In the world of reading biopsies, bigger is not better necessarily. It's clear that the usual way these biopsies are handled sometimes just isn't enough. So one alternative solution involves creating a barcode that uniquely identifies you from a DNA sample swabbed from your mouth. That code is attached to your biopsy, and if it comes back positive for cancer, those cancer cells are cross-referenced against your own DNA to make sure there hasn't been a mix-up. That's good news in preventing lab errors. The bad news is the DNA fingerprinting safeguard will cost around $300 out of pocket, as Medicare and many private insurance companies don't cover it. That, however, may be changing, at least for guys. In May, legislation was introduced that would force Medicare to cover the DNA double check for all prostate biopsies. But don't hold your breath waiting. Even if and when that comes about, it will still be leaving ladies in the lurch. That's why you need to take matters into your own hands by following these two safeguards. Number one, get a second opinion. I know you've heard that one before, but in this case, I'm talking about a second read on that biopsy. Number two, if your biopsy was taken at a different location than where you're scheduled for surgery or treatment, make sure an expert in the hospital has reviewed it. That simple question would have saved Evelyn Rodriguez a whole lot of pain and suffering. Most of all, think that asking any question, especially if it's for your second opinion, is an insult to your doctor or any other health professional, because what's even worse than being told you have cancer is being treated for it when you don't. And even if that cancer diagnosis is correct, don't rush into risky treatments without exploring your options. For guys, that can mean doing active surveillance, something we've reported a lot on lately, instead of having your prostate removed or undergo radiation therapy. Yes, sir. Think twice. All right, ladies and gentlemen, it is now time for topic number 5, your final one, and this one is going to be a little bit surprising. We've all seen those drug commercials on TV with pleasant-looking grandparents frolicking in a grassy field with an adorable puppy, living life to the fullest when an announcer talks about how Big Pharma's latest poison is going to make your life every bit as joyful. Then comes the obligatory rushed reading of a list of side effects. When the commercial is over, the general impression is a positive one. This drug is going to make your life better, but you might have a few minor problems like drowsiness. Drug companies might be required to tell you their side effects, but they have invested a lot of money in finding ways to present this information in the most positive light possible, and when that approach don't work, they do their best to deliver it in a forgettable manner. These efforts appear to be paying off in more ways than one, because now the FDA, listen to this, is considering scrapping them altogether on the grounds that TV viewers simply don't listen to the side effects list. When this move, it appears the FDA cares less and less about making their collusion with the Big Pharma obvious. In an effort to make the process seem reasoned, health officials propose a study that will assess whether people actually read the ad warnings. They claim they are worried that critical information is getting lost in the shuffle, causing people to overlook more serious warnings. Should the study confirm the suspicion, the FDA could scrap the list entirely, as they find other ways to safely market medication. In fact, they say that people are more likely to read a medication's risks on a page-long full summary of safety information than they are to read it on the type of brief summary used on an ad on TV. Of course, you won't have that information in your hands in the first place until after you've talked to your doctor and as these commercials suggest you do, and somehow convince him or her to prescribe you the medication. In other words, you've already been bought and paid for by the time you see the drawbacks, which means you're more likely to take your chances and simply take the meds, even if you don't ultimately take the drug. They've already got your money. The director of Farmed Out, a project run by Georgetown Medical Center, Adrienne Fuberman, believes that allowing drug companies to use the limited side effects they include in ads is highly problematic. She pointed out that's why ads for erectile dysfunction say may cause 4-hour erection, because that doesn't sound too bad, kid guys. They kind of like that idea. Unlike other side effects such as a heart attack. We don't want to say that. Let's say 4-hour erection. The U.S. is one of the only 2 countries that allow pharmaceutical companies to place direct-to-consumer TV ads. And Big Pharma has found a lot of ways to make that required side effect warnings more palatable. For example, some ads will have one narrator tell viewers about the drug's benefits and then use a different voice actor to run through the risks using a less engaging voice. Another trick they employ is reading the list of warnings using more complex grammatical structures so it's not as readily absorbable by viewers. Keeping the voice actor who lists the risk of off-screen is another common tactic, as research shows people absorb more information when they can see a speaker. In addition, they sometimes show distracting images while this list is read so people won't focus on the words. The FDA does not approve ads before they are aired, but they can claim they will stop the ads that violate the law after the release. Their guidelines do not require drug makers to tell the people if lifestyle changes like diet and exercise could help improve their condition, nor do they ban ads for medications that pose serious risks. Now the FDA is poised to remove yet another obstacle for drug makers to make it easier than ever for them to convince people that their poisons are completely harmless. So, we're the only country outside of New Zealand that has these ads, and now we're going to get rid of the warning side effects. Unbelievable. Well, let's get on to some positive information. Testimony number 1, Dr. Harry. I have high blood pressure and 2 glasses of Cardio for Life have been keeping my blood pressure under control for the last couple of years. I am 63 years old and started going back to the gym 2 months ago. The Man Up and Slim are doing a great job of putting my muscles back the way they were years ago. I am looking younger than ever. Thank you for that, David. Testimony number 2, just a short note to let you know how pleased I am with Cardio for Life chewables. I have more stamina, energy, and an overall sense of well-being. I am even sleeping better. I've been taking 1 tablet per day for 60 days. I will be increasing it to 2 tablets per day and will let you know if it turned me into Superman. All joking aside, a fantastic product. I will be looking at your product website to see if there are any more of your products to add more quality to my life. Thank you for that, Jody. Jody, Kate, a little tip here. 2 chewables is 1 serving. So you should be doing 2 chewables twice a day. First thing in the morning, last thing at night. You will be Superwoman, for sure. Testimony number 3. The best nitric oxide product on the market. Always sells out before similar products on my clinic shelf. Can't beat the added vitamin D3 and CoQ10. People also really like the taste over others. Shipping is expedient from the time I place the order and sometimes within minutes of ordering. Reliable and fast. Thank you for that, Dr. Maria Angel from All About Health in Alaska. Testimony number 4, I deal with Health Guardian products for work. Ordering Cardio for Life for our facility I work for, which is Doctor's Choice in Pottsville, Pennsylvania. Dr. Novotnik highly recommends this product, and our patients continue to come back and buy Cardio for Life. Not only is it a great product, Dr. Harry and his staff are top-notch. The customer service is wonderful. Well, thank you so much for that, Tracy. And that completes our top 5 to stay alive for August 2017. Please go to the archives if you want to look back on past top 5. There's a search engine. You can put in whatever information like Zocor or Lipitor, and all the past top 5s will pop up over the last 3 years. And with that said, this is Dr. Harry saying God bless you all, and we'll see you again next month for Top 5.